Now, the modern society, as we are trying to move towards, is full of stresses and tensions. Now, the other thing is that socio-economic circumstance. No doubt. In fact, last year, when we had the 20 people committing suicide and you opened helpline, we had about 200 calls a day when we were at the peak of people attempting. Somebody will tell you that I have pills in my hand, I'm ready to swallow them. Somebody will tell you that I have a snooze on the ceiling fan, I'm ready to hang it on my neck. And when you go further to ask what is causing this, a lot of them socio-economic problems. I finished school, I don't have a work, or I've been sacked from my work, my husband has run away and I have to be a single parent. These are real issues. My salary is not enough and I have my siblings to take care of. Socio-economic issues. And as they are not able to find a way, eventually they are driven into depression and to consider mental health issues. We need to recognize this as a nation and prioritize mental health. Unfortunately, we are not doing that enough, evidenced by not giving enough resources. In fact, in the last 3-4 years, it's only last year that towards the end of the year, we had money released. Just 1 week to the end of the year that we had money released by the ministry. So the previous 2-3 years, not a single person to the authority. The psychiatric hospitals were equally suffering. So as a nation, we need to prioritize, and prioritize means give the resources. As of now, we are still really struggling to pass the mental health, the airline to the law, legislative instrument to the law. It's not been passed. And we are hoping that when the airline is passed, we will be able to get funding because it establishes levy, mental health levy, that will give us the funding to be able to operate mental health care. It's not been established. As at now, we don't have a board, mental health board. All boards were dissolved last year with the inception of the new government, but that's over 1 year. A number of boards have been formed, but ours has not been formed. Why? Is it because nobody cares about mental health? These are real issues. So as a nation, we need to prioritize, give attention to mental health. But as we are talking about the nation to prioritize, you, the individual, you have a major responsibility.